Hello and hi, my name is Muhammad Ifan bin Jamain. So I am who is the first presenter for our group. Today, I want to talk about ROS2 based assistive robot in healthcare. To begin our presentation, let's first define what an assistive robot actually is. Essentially, these are robots specifically designed to support both patient and healthcare professional. You will commonly find them integrated into hospital environment, elderly care facilities, and rehabilitation centers. The facility allows them to perform a variety critical tasks, such as continuous patient monitoring, the delivery of medical supplies, and general day-to-day assistance for those with limited mobility. So now, moving on to the background of our project. A key component is the role of ROS2. ROS2 stands for Robot Operating System, which is an advanced framework that serves as the brain of the robot. It is vital because it enables seamless communication between various robot components. Furthermore, it supports real-time and highly reliable operation, which is why it has become so widely used in modern robotic systems today.
Hi, my name is Marcelina Wilfred and I am going to talk about the ethical issues in healthcare robots. One important issue is patient consent, where patients must give permission before robots are involved in their treatment or monitoring. Another issue is trust in robots, because patients need to feel comfortable and safe when using robotic technology in healthcare. There is also the responsibility for errors, especially if the robot makes mistakes during operation. Next is patient privacy issue. Healthcare robots collect sensitive patient data such as health records, vital signs, and personal information. Since the data is stored and transmitted digitally, there is a risk of data leakage or unauthorized access. Therefore, proper security and privacy protection are important to keep patient information safe.
I, Lydia Ratika Ganti Zanaro, Normometry B11231047. I will explain about this group. Number one, cyber attacks and data leak on healthcare robot are highly dangerous because this device handles sensitivity patient data, include medical record, vital signs, and private recording. Hacker can approach with Wi-Fi on unencrypted operating system ROS2 to steal this data or manipulate the robot function. Consequently, patient safety is severely compromised when medical information is altered or the robot is hijacked, leading to strict privacy violations and total loss of trust in hospital system. Point number two, access by hacker and other individuals who do not have authorizations is when individually bypass security measures to gain control of the system of the healthcare robot. The risk of access may be because of weak password, shared password, and poor user management in the system. The impact of the attacks may lead to a situation where the hackers gains control over the movement and other operations of the robot or given the wrong instructions, which can result in havoc in the hospital. And explanation for challenge in implementations. Point number one is higher cost. Implementing cybersecurity is a major for healthcare robot face major hurdles, starting with the higher cost of acquiring advanced security software and maintenance license. And point number two, a lack of technical expertise poses challenges as security specialized robotic system like ROS2 require highly skilled professionals who are limited in the healthcare sector. And number three, this problem are compounded by integration issue where blending a new security protocol with a hospital audit legacy system can cause operational disruptions and create new security vulnerabilities.
I am Amina Farah Norman. I am from BLR 211. So today I will talk about limitations of robots. First, no emotions or empathy. An assistive robot cannot feel compassion or offer a shoulder to cry on. In a healthcare setting, if patient receive bad news or is in pain, a robot can record the data, but it cannot provide the genuine empathy that helps a patient feel understood and safe. Second, limited human interactions. When hospitals or care centers rely heavily on robots for tasks like meal, delivery, or basic monitoring, the patient loses out on meaningful face time with human staff. This leads to clinical, mechanical environment where social cues and the human touch are replaced by sensor-driven response. Third, patients may feel lonely or uncomfortable. For elderly patients, for those in long-term recovery, the presence of machine can be intimidating rather than comforting. Without human warmth, patients often report feeling like tasks to be complete rather than a person being cared for, which can negatively impact their mental health recovery speed. Potential problems. First, system failure can disrupt operation. If an assistive robot responsible for moving heavy patients or transporting critical medication suffers a battery failure or a software crash, human staff must then drop their current duties to handle the robot's failed state, disrupting the entire flow's workflow. Second, our dependence reduces human skills. If nurses and healthcare assistants rely entirely on robots, their own manual expertise may weaken over time. In an emergency where the technology is unavailable, the staff might find themselves physically or mentally unprepared to perform those tasks at the same speed or quality. Third, technical issues require experts. When a robot malfunctions, the hospital becomes dependent on external, highly paid robotic experts. This can lead to long downtimes on extremely high repair costs that drain a hospital's budgets.
Hi, my name is Amira Hira. I'm from class PLR, and today I'm going to talk about human versus robot care. So first slide is the strengths of robot. So we have 3 points. So first point is robot can work 24 hours without fatigue. Robot doesn't get tired, doesn't need to sleep, and never have a bad day. For example, robot can monitor the vital patient all night long or deliver medicine at 3 a.m. with exact same energy and efficiency as it would at noon. And second point is high accuracy in repetitive tasks. Doing the exact thing over and over can make human bored or distract, leading to mistake. But robot is exact at precisely. For example, if a robot is programmed to measure out exactly 5 mm of medicine or sort of thousands of medicine files, it will do perfectly every single time without making careless typo. And third is reduce the workload of nurse and doctor. Because robots handle the repetitive and bored chores, human business staff have more free time. For example, if a robot carry heavy laundry, deliver food tray, or clean hospital room, nurse can spend less time running around and more time actually talking to and caring for a sick patient. And we go to another slide. Limited of robot. Robots have no emotion or empathy. A robot operates on code, not feeling. It cannot truly feel sorry for a patient or understand sadness. For example, if a patient receives a bad medical news and starts crying, a robot might just sit there or give programmed robot response. It cannot offer genuine and warm comfort. And second is limited human interaction. Robots are bad at reading between the lines. They only understand direct command or data, missing out a natural social cue. For example, a good nurse can look a patient's face and realize they say they are fine, but they look like they are in pain. A robot will likely just take the patient's words for it and move on. And third is, patient may feel lonely or uncomfortable. People need human connection to heal well. Being surrounded only by machine can feel cold, scary, and isolating. For example, an elderly patient or scared child in hospital bed feel much more safe and happy holding a real person's hands than interacting with cold metal machine. That's all from me.
Hello everyone, my name is Lomeo. I am from 3PLR S11. Now I would like to continue with the part of conclusion, which is balancing technology and humanity. In conclusion, technology and humanity must work together to create a better healthcare system. Robots and AI can improve healthcare efficiently by reducing workload, speeding up process, and increasing accuracy. For example, robots can help nurse deliver medicine to patients, assist elderly people in nursing home, and support pharmacists in organizing prescriptions more efficiently. AI system can also help detect diseases earlier and manage patient record quickly. This technology make healthcare service faster and more effective. However, technology cannot replace the human touch. Patients still need kindness, empathy, emotional support, and personal communication from healthcare workers such as nurses, caregivers, therapists, and counselors. For example, while a robot can remind elderly patients to take medicine, only a caregiver can comfort them when they feel lonely or afraid. Human understanding and compassion are important in building trust and helping patients feel safe and cared for. Therefore, the best solution is a combination of both technology and humanity. Technology should be used to support healthcare workers, not replace them. By working together, human and machine can provide healthcare that is both efficient and compassionate. For the part of future improvement, healthcare technology should focus on delivering better AI interactions so patients can communicate more naturally with system and robots. Stronger cybersecurity is also important to protect private patients' information from cyber attacks and data leaks. In addition, healthcare systems should become more user-friendly so that patients, nurses, caregivers, and elderly users can use the technology easily and safely without confusion. That's all from me. Thank you.